Endometriosis. So we see a lot of endometriosis here in the clinic. We have a lot of patients that find out that they have endometriosis while they are patients of ours. So we can kind of go over it, how we treat it, what red flags we look for in order to help refer out to appropriate providers and things like that. Endometriosis is pretty common in a lot of women, and a lot of people know it for having symptoms like very painful periods, pain with intercourse, pain around ovulation, sometimes even bladder or bowel changes can be indicators of endometriosis. So we look out for some of these things and kind of coach our patients on, reaching out to a doctor and really explaining those symptoms to them so that they can get the care they need. Unfortunately, as you probably know, the only way to diagnose endometriosis is through laparoscopy, which is a surgery. So it's often not a first line of treatment unless there are a ton of symptoms. But often it will even be done after, say, a few cycles where everything looks really, really good and things just start working out and there's no necessarily known cause to why someone struggled with infertility. So they may do an exploratory surgery. Some women find out that they have, stage 2, 3, or even 4 endometriosis without any symptoms other than infertility. And it can be really validating to go through that surgery and find that out, like the endometriosis was pushing an ovary or really just making conception impossible on your own. So it can be sort of validating to know that, okay, there is something wrong, like we can correct it and we can move forward from here. And so in the clinic, here in the acupuncture clinic, we treat endometriosis all the time. So we treat it symptomatically in women that either are or aren't trying to conceive. So to help reduce pain, improve quality of life, deal with bowel changes, reduce inflammation, things like that. And then in women that are going through fertility treatments, reducing that inflammation, helping with pain and things like that can also be beneficial. So in some cases, I've had patients where the fertility treatments actually sort of flare up endometriosis symptoms. So we do some work to kind of keep those a little bit at bay while they're going through the cycle, just to make it a little bit more comfortable. And in Chinese medicine, things we look at a little bit different. So the diagnosis of endometriosis is often qi and blood stagnation. The endometriomas, if you've ever looked at a laparoscopic surgery pictures, are sort of purple and dark like a bruise. And so in Chinese medicine, we consider that blood stagnation. So just like a bruise is literally blood stagnation under the skin. So we use points and sometimes herbal medicine when appropriate to help move that blood. And then when that blood starts moving, qi starts moving, that pain gets better, inflammation gets better, and things improve. However, I will say acupuncture is not a cure for endometriosis whatsoever. It really isn't a cure, but you can, obviously have surgery to improve things, which is often indicated in a lot of folks as well. So we try to take an integrative approach and watch out for some of these red flags to help coach our patients on when to seek out additional care.